Alright, well, sorry about the interruption. Got a phone call if you didn't hear that loud old noise. Um, so, where was I? Was fast forward to today, and, I don't know why, because I'm gonna go backwards probably again. um, I'm gonna moisturize my face with some, what an anti-aging wrinkle cream, which ain't helping because I got wrinkles. um, so talking about Savannah. Mm, it's hard to talk about mental health, especially when it's not about you. It's about a family member, a loved one. Um, if you say things you feel like you're maybe being judgmental and people might think you're harsh. And the reason why I say that is because throughout Savannah's 16 years, so when she was from newborn to about 4, well, within that time, Savannah had problems with her bladder. She kept having urinary tract infections. So at this time, that was around when she was going to be 1 years old. And I lived in a homeless shelter with her at that time. She kept getting sick. She kept getting UTIs, and the fevers would be extremely high. And I'd take her to the emergency room, and they would be like, "Well, you're wiping her wrong," or all my brushes are in the room. I'll just cover up right now. So, I can't because my brushes. Anyways, so she had urinary tract infections for like 6 months of a year, her first year, and I was taking her to doctor after doctor because they were not telling me something was wrong with her, and I knew something had to be wrong. Uh, so it's hard to talk. Look at, I cannot multitask. I can't do makeup and talk at the same time. I can't even see myself without my dang glasses. Isn't that a shame? That's what happens when you get older. So, anyways, um, I finally got her to this one doctor who uh, told me yes, Savannah had what they called reflex in her bladder. So her bladder, the tube from the left side from her bladder to her kidney, was opened at a level 5, which is the worst it can be. So that means her urine was traveling to her left kidney for that 6 months, and it was killing her kidney. So we found that out, and then we had to wait until she was 2.5 because that was the youngest they had ever done that surgery. I'm using this as a mirror, and I can't see. I don't want to look like Ronald McDonald or anything. Let's see. So 2.5, we had surgery in a children's hospital, and that got better. No more reflex. She just has a destroyed kidney. Um, and she was developing good. She was a normal kid to me. She was cute and she loved to dance, and even at really small age she had good rhythm. People would be like, "Wow, your daughter's dancing good." She seemed to be developing just fine for me. I mean, except for the occasional take her to the park, and every single time she'd throw a fit. Couldn't get her out of the park. But that was just a strong will. I didn't find anything wrong with that, because who wants to leave the park when you're little? So, even she did Head Start school. They didn't say anything was wrong with her behavior. It's just she was really touchy towards her friends. She didn't have boundaries. And they always said that. And then she went to kindergarten, and there they said she had problems with ABCs and counting and all that stuff. Um, then first grade came. Geez, it's like I had a whole nother kid. I don't know what happened from that, but Savannah started acting in a different way, acting out. She was, oh, I got this thing in here. This girl was throwing full on temper tantrums, laying on the ground, throwing chairs, destroying her pencil box and everything, getting in all kinds of trouble at school. And, as the mother, you want to be a good mom. You want to be proactive, do what you're supposed to do as a parent. I don't know how to do makeup, so don't judge me. And be proactive in their schooling and in their life. We want balance. So, again, I took her to a doctor, and there they diagnosed her with, guess what? ADHD. Look at this, isn't this cute? Oh, I got makeup on it already. Hold on. Watch the ears be all crooked. And that's some cute stuff. So, anyways, I had to take her to the doctors and diagnosed her with ADHD. And I didn't question what their diagnosis was or how they came, about that. I'm just her mom. I don't know. I didn't know anything about ADHD. Well, I've learned a lot since then about her mental health. So, they put her on medication quickly. They gave her counseling. And within a year, she was already, so this was like, she was 6, 7. So within a year, they said, well, we're going to close her case here at Sierra Vista because she's met her goals and she's not talking, so she doesn't need to be in counseling. So they discharged that, but they kept her on a medication, Vyvanse, which is a stimulant medication. And, boy, I didn't know what was to come, her having that medication. It was horrible. Horrible. Savannah started being an angry kid. And she wasn't like this. So she started throwing these violent temper tantrums at home to the point that she would burn out, physically exhaust herself from these fits. And I mean, for nothing. It could be take a shower, it could be put on clothes. I mean, it didn't matter what the reason was. She was just throwing these temper tantrums. And then these temper tantrums went from that to extremely violent anger outbursts, and she was punching holes all on her walls. These holes were massive. These holes were like if a car had driven through the wood, the wall. And I'm here having counseling back, asking these people to come in my house because see if it's something I'm doing as a parent, why she is the way she is. I'm calling the cops, and that never was the answer. The cops never helped. They made that situation worse for me. But these counselors just started, oh well, it's must be something that she went through as a child. She's traumatized, maybe it's the parenting, They just want to put the blame somewhere because they can't understand it either. Well, we did this for 7, 8, 9, 10. I would say at least 3 years. And then we got to the point where I got kicked out of the apartment that I lived in. And yes, I was on Section 8. So you guys can make fun of me all you want. I utilized my resources to get the assistance we need, and I did that. And so I had Section 8. And I did tell them that she damaged the property, but I have fought for her to get Social Security, and I won it. So the Social Security back pay was gonna pay, back pay, so I could repair all the damages. So Section 8 failed the inspection, but once I fixed it, they what do you call it? They accepted it. It was fine. But the landlords wasn't fine, and they evicted me. So here it is 2 years later from that, and I have what do you call it? I'm suing them for this. I can get off on all kinds of damn things. I don't know how to stay on track with this. And I can't tell you her whole life in this video. Let me see. So, sitting here and researching mental health, I did a lot on YouTube. And watching people come on here, and as vulnerable and scary as it is to talk to the world about your problems, I felt a sense of understanding, a sense of goodness, because throughout her mental health challenges, I have never felt supported from any social outlet. Nothing. Nothing at all. And I've had these services from the time she was in first grade, and now she's a freshman in high school. And the battle's been real hard. Real hard. And I'm not going to tell you from that point to this point where we've gone, but don't let them tell you your child is ADHD and then leave it at that, because that's just the beginning of signs of mental health, and they don't know what to call it. And they still don't know at 16 what they want to call it, because if someone is suffering from bipolar disorder or borderline personality disorder, they do not want that diagnosis as, a teenager, an adolescent. And throughout my travels of going to different psychologists, different counselors, different people, wanting to know what is it, it's got to have a name. And it isn't just ADHD, something's wrong. And they're like, oh, you shouldn't label your child. You shouldn't put labels on your child. But to be honest with you, how can you honestly help somebody struggling with something if you don't know what it is? You don't have a patient come in with a heart problem and fix their leg. That isn't going to help. So it's the same thing with mental illness. And mental illness has such a high stigma. It's just amazing and sad. And I have Medi-Cal. She has Social Security. I don't know why she didn't have a different Medi-Cal now, but she has Medi-Cal. And I guess she don't get the kind of services that she needs. And California and mental health are not friends. They really are not friends. For a long time, I didn't know what to do with her. I really wanted them to put her in a home for behaviors, and to help her, because I felt that I couldn't keep her safe or us safe. And I'm kind of glad that that didn't happen. I'm glad, because looking back now, and like I was emailing Dr. Phil and wanting someone to help me. I couldn't find that resource. It wasn't out there. But just gotta stay strong, no matter how bad it is, how bad it feels. I don't want to cry on here. Don't want to cry. Finally, they took her off of that ADHD medication. Her anger has gotten way less. Her anxiety has gotten way less. But where we are now, she's 16 years old, and through learning about mental health and what signs and symptoms there are, my daughter is more towards borderline personality disorder. And she does cut. She doesn't want to live sometimes. She has been hospitalized 5 times, and she's 16. And as a parent, it's easy to think about what did you do to make your kid that way, because that's what they did. It's like, well, something's got to have triggered her. Something has to be going on, what she must have had trauma. She hasn't had the easiest life, but she sure hasn't had the worst. I've protected her, I've loved her, and I have been a fighting advocate for her, and I haven't given up yet. Self-care is important, though. When you're dealing with a child with mental illness and your life seems like it's nothing but dealing with that, you start to lose your sense of who you are or what you're doing, and not feeling strong enough to continue. And I started trying to find a way out. My way out was drinking. So for a few years, I became an alcoholic, and I drank a lot to try to kill the pain, stop it from hurting, or try to ignore it. I don't know what I did, but it wasn't working. Self-care is very important, and finding a support network of people that have gone through what you go through, know what you're going through. That's why I'm here on this platform, because there's going to be people that can relate to what I'm saying, and I'm not alone. I'm not alone, and you guys aren't alone. And I pray for change. I pray for this world to change. It's anyways. I didn't want to cry on this damn YouTube. I don't want to sound crazy or unstable. What I came here to do is to be not a motivational speaker, a DIYer. So I hope that you will come to my channel, because it's not just a depressing channel. I actually look back at my videos and it makes me laugh. There'll be lots of funny things and lots of fun along the way. I am a beginning DIYer, so I have lots of things in mind, but how the outcome will be is beyond me. So please stick around and be a part of my community. Help me, support me, love me, because that's what I need. Is a good community of people that love one another, that aren't out to hurt people or say mean things, but to encourage one another, lift each other up, This world's so hard on its own. We don't need people to be evil and harsh and mean to other people's suffering. It took a lot for me to put this out here. I'm afraid my phone first had to upload a video, but now it's just sharing. Look how red I am. It's because I'm not sunburnt. That's, I think, because I'm embarrassed how red it is. I don't know. Look, my neck's all white. But I don't have an intro yet. I don't have a picture up. I don't know how to do anything on YouTube. This is like the beginners. So however it looks, it looks. Look at my bunny ears. It's my makeup hair pusher upper. Well, I guess I'm going to get off because I can't do makeup and be on the YouTube at the same time. I guess I can't multitask. I will be back on in a little bit so that we can paint this wonderful bottle. And I'm thinking about painting it with the rocks. And then I have a cool, what do you call it? Airbrush. What do you call it? Yeah, airbrush. Oh! Mosquito eater. I haven't used this yet, and I don't even know how to use it. I was going to YouTube it and see how it works. I don't know. Maybe that we could do that. Maybe not. Maybe we'll mess up the bottle together and then throw it away. I don't know. Please, come back. You don't want to miss out all this craziness. All right. Till next time. Love you guys. Bye.